Hello, everybody. Dr. Torres here, sending you all my best. I am wearing a surgical hat because I haven't had a haircut in like 7 weeks, so I apologize for that. You guys know what that's like. I know this has been a very challenging month for everybody. Please make sure you check out a presentation I sent you on your email about how to maintain your emotional well-being during this pandemic. You're not alone in your worries. Raise your hand if you have experienced anxiety. Raise your hand if you have worried about your elderly parents, or if you feel uncertain or experience insomnia, for example. I've been there. Please do take the time to look at that information, okay? I continue here our series on going beyond the score, and I want to address a topic that is coming up over and over with our patients lately, and it's the issue of communication. Patients are scared. We are tense as providers. We are having to institute visitor policies and being extra careful to screen people and keep them apart, etc., etc. Our patients understand that we're in a difficult position. They see the news. They know what we're going through. In their feedback, the same topic keeps coming up. We want better communication. And it's easy to understand, right? Because when you're scared, you want information. You want reassurance. Let's take a look at this image. It shows the scale of what patients consider to be important. See if you can pick up the pattern. When you boil this down to basics, they want communication, number one, and a sense that they were respected, number two. This data comes from one of the largest surveys of patients by the Cleveland Clinic, and the results have been validated by many other studies on patient satisfaction. Let me share with you an actual patient experience that illustrates the importance of communication perfectly. I went to see a lady who had been brought back for evaluation of abdominal pain. I always try to be there when our nurses or techs are trying to get the initial history so that the patient doesn't have to tell their story multiple times. So I get in the room and I tell her, "Hi, I'm Dr. Torres. Sorry to meet you like this. I'm going to sit there in the corner and listen. Patty, our nurse, asks you some questions. That way you don't have to say the same story twice." So then she proceeds to tell us that she just got out of another hospital down the road. She was admitted for several days. She is here for the same problem she was just discharged for. So we ask her if she knows what she was diagnosed with. And she says, "I don't know. They never told me what my problem was." And so just out of curiosity, I asked her, "So tell me, did you go through their ER to be seen?" She says, "Yeah, the doctor came in and out for a minute and then nobody told me. And I just was wheeled upstairs to a room and I found out I had been admitted." After several days of staying in the hospital, she says that people came in and out of her room several times, but that really nobody communicated her what was wrong or what they had found out. And in the final day, they handed her some papers and they discharged her. So I asked myself, how is it possible? How is it possible that you can go through an ER, be admitted, stay in the hospital several days, and never know what you're there for, or be told what was wrong with you? And this lady, I don't think was lying to me. I think she truly did not know. And it was just unbelievable. Anyways, clearly there were only two possibilities, right? Either the patient was told and she never understood what she was being told, or, and more scary, the patient was never told anything. Even though that other hospital was not part of our network, I felt bad as a healthcare provider. She had been let down by the system. It is important for us as healthcare workers to communicate with our patients, to let them know what we're thinking and what is going on, and at least what the diagnosis has been, and answer some questions. So communication is just so important. It allays our fears, it helps us to understand what is going on, and it calms our anxiety. We're in the business of helping people heal, and a big part of that is to communicate with them and tell them what we are thinking, what is going on, what is going to happen, and to let people know everything will be okay and that we will figure it out. It is one of the ultimate forms of human bonding. Communication is part of the Imerys care model, which I have right here behind me, is notify along the way. So we keep the patients informed throughout the visit. What is happening? Why is it happening? And when is it happening? During this pandemic, I really wish someone would look me in the eye and tell me that everything will be okay and that we will figure this out. I want to know. I want that communication. It is the same with all of us and our patients. So here's your challenge. During these trying times, let's rise above by communicating with our patients. I promise you that they are just as scared as we all are, and perhaps even more so because they're afraid to come to the hospital. Thanks for what you do. The whole world says thank you. Stay safe, stay smart. This will pass. We will figure this out and come out better on the other end. Until next time, see you later.